Hello and welcome to another great video of Category 2 SOT. My name is Skyler Dumas and I'm here to show you how it's done today. First off, the definitive test for Category 2 is going to be your arm faucet test. We're going to go ahead and take a look here at a supine leg length check. We're going to go ahead, bring the patient's feet out lateral, have them push into my hands for 3 seconds, brings them back together while tractioning. Look at the medial malleolus for the superior one. In this case, the superior one is the patient's right leg, the patient's short leg. So we're going to go ahead here, and now we're going to do our arm faucet test. We're going to do the upper and the lower. If the upper arm faucet test is weak, then we would expect medial knee pain on the short leg side. If it was a lower arm faucet test, then we'd expect lateral knee pain on the lateral side. The muscles involved in a lower LLL are going to be rectus abdominis and the TFL. If there's no congruency in the initial visit, check for an upper cervical or lower lumbar problem, usually C1 or L5. Also, the muscle involved in a upper weakness is going to be the sartorius. Now going on to the blocking, it's going to be patient supine. It's an active blocking, so we can have the patient assist in getting them there to bring the blocks. And we're going to block according to the short leg time, and there's going to be a maximum of 2 minutes here. So here are my blocks. We determined that the right leg was the short leg side, so I'm going to ask my patient to raise up here. I'm going to place this block halfway on the, you can lay back down, lumbar erectors, halfway on the iliac crest, and it's going to be perpendicular. I'm going to go to the opposite side here. The patient's going to rise up, and underneath the acetabulum here, going in a superior direction. Good. We're going to have that block. The goal of the blocking here is to strengthen all 4 fauces. Let's see. So we've got those. So next thing we can do is we're going to recheck the arm faucet test. If it goes weak, then we've got something wrong. We're expecting them all 4 to be strong. If it goes weak, then we're going to remove the blocks immediately, let them get up, walk around. If not, we're going to go ahead and here, and we're going to expect improvement, but we're going to augment the blocks, just give them a little shimmy shake, make sure we have them right in the correct positions. So after part of the block augmentation, we're going to have bilateral thigh pressure on the A to P directions, just proximal to the knee, not over any blocks. We're going to do this for about 10 seconds here. We're not going to do the full 10 seconds because ain't nobody got time for that. But next we're going to go ahead and we're going to put diagonal pressure on the pelvis, but making sure we're not on the blocks. And this is going to be done for an extra 10 seconds as well. After that, we're going to go ahead and check the cranial fault for basic 2. So we're going to start out, we're going to go ahead and muscle test whether there's an inhalation or an exhalation fault. So have the patient's arm up, deep breath in, and we're going to test the muscle, deep breath out, test the muscle. We're going to see which one of those is weak, whether it's inhalation or exhalation fault. Our patient instructions on this, we're going to have them inhale, put the tongue to the roof of their mouth and point their toes up towards your head here at the same time. And then on exhalation, you can just relax your tongue and point your toes down. So my hands, I'm going to have one hand on the frontal bone, one on the occipital bone, and from there I'm going to go ahead and perform the basic 2. If there's an inhalation fault, we're going to correct by putting our hands together and pulling in an I to S direction during exhalation, as well as if there's an exhalation fault, I'm going to contact same positions and go S-I during inhalation. So we'll go ahead, I'll kind of demonstrate, hopefully you can kind of see where we're at here. So I'll be on the patient's head like so, you can kind of see, have the patient breathe and correct accordingly. Let's see, next we have, to lock that in, we're going to go ahead and do the reversed AFT test. So patient's arms up, and I'm going to ask them to push this direction. All right, go. Expect it to be strong. If it's not, then we know we got to go to the next thing. Sorry. If the legs remain uneven, then we're going to do the post-blocking technique. So we're going to check. Short leg side, we're going to go flex the hip, go lateral, bring it medial. Long leg side will be opposite. So here on the short leg side, hand under the knee and ankle. I'm going to flex, go lateral to medial, and extend. and we're going to do this 3 times. And then we're going to go to the long leg side, and this side is going to be medial to lateral. So we're going to go up, and we're also going to do this 3 times. So now that we have finished the blocking technique, got to make sure when we remove the blocks, we do them at the same time, do it gently, and it's not patient assisted, so we're going to pull these out. So after that, we're going to go to the sacral cup. I'm going to ask my patient to flip over. Alright, so I'm going to ask my patient to raise this leg here up about 30 degrees, push on the iliac crest, chest in a P to A direction, check to see if it's strong. Same thing on the opposite leg here, and push, okay. So we're feeling for a weak leg. If they're both strong, we're good. This is not an indication of anything. So say we have a weak left leg here. I'm going to again ask the patient to raise their leg. I'm going to push on the 2 spots on the sacrum, one above S2, one below S2, and recheck. So boom, boom. The second one caused it to go weak. The first one made it go strong, so I'm going to go ahead and push on that first one for 5 to 10 seconds, and then I'm going to go ahead and retest the leg after that. And that should do it for this Category 2 video. Hope you all have a great day and stay groovy.